South Africans could soon face an additional 37,000 Rand in payroll taxes each year to fund the National Health Insurance Scheme. But is this fair or sustainable? In this video, I break down the shocking cost of estimates, the potential economic impact, and whether this plan is realistic for our country. Welcome to the Riaan Roux Show, where I look at those stories that affect every South African in some or other way. Each South African worker would need to pay about 37,000 Rand or more in payroll tax each year to support the National Health Insurance, the NHI scheme. This is how the NHI will then be used to buy healthcare services from both public and private providers. According to the NHI Act, all eligible South African residents can access these services when they need healthcare without having to pay directly. Under the current provisions of the NHI Act, once fully implemented, private medical aid schemes will be limited to providing coverage only for services that are not included in the NHI's basic benefits package. This means that any healthcare services covered by the NHI fund cannot be duplicated by private healthcare insurance plans. The cost estimates for the National Health Insurance in South Africa, the NHI, vary significantly, reflecting differing perspectives between the government and private medical aid providers. The Department of Health estimates that the NHI will cost approximately 200 billion Rand annually. This figure is considered a baseline for funding the proposed universal healthcare system, but many experts believe it is likely an underestimation given the complexities involved in implementing such a comprehensive program. Private medical aid providers and health analysts argue that the actual costs could be substantially higher. For instance, Discovery Health suggests that if the NHI were to cover only the prescribed minimum benefits, that the cost could reach 800 billion Rand per year. Momentum estimates that providing healthcare, which is similar to the private sector, would cost over 1.3 trillion Rand a year. This is based on a spending an average of 1,750 Rand a month, or about 21,000 Rand a year, for each of the 9 million private medical scheme members currently. If the NHI wants to cover the same care for all 63 million South Africans, it would cost around 1.3 trillion annually. Momentum says that using medical aid tax credits and economies of scale could reduce the cost to around 900 billion Rand a year. But even after deducting the current healthcare budget of 272 billion Rand a year, the NHI would still need an extra 628 billion Rand a year, which is much more than the government's initial 200 billion Rand estimate. The difference in cost estimates mainly depends on how good and complete the NHI's care will be. If the government wants to provide medical services which are similar to private healthcare, the costs could be much higher than their initial estimates. Remember, the government's cost estimates are based on current state-level care, which is much lower than the private sector care. And the health department's estimate doesn't include primary care, chronic care, maternity care, or basic benefits. And the cost will go up if the NHI covers long-term hospital stays and specialist procedures. The government is looking at different ways to raise the money for the NHI, such as higher personal income tax, VAT, and a few others. Recently, the idea of funding the NHI through a payroll tax was suggested. The basic idea being that a payroll tax is then taken from an employee's salary to fund the NHI, much in the same way the Unemployment Insurance Fund works, or the UIF is funded. This would mean that each of South Africa's around 6.9 million employees would need to pay an extra 37,159 odd rand in payroll tax annually to fund the NHI. Such a large tax increase would be unsustainable for most South Africans and could lead to many leaving the country. Discovery CEO Adrian Gore said this would destroy the economy. He also said, "It's not just a healthcare issue, it's a real economic problem. People wouldn't tolerate paying 30% more in taxes and getting 70% less healthcare." Adrian Gore stated that the NHI plan, as described in the NHI bill, is too expensive for the country to afford. He believes the plan could work if the economy grows rapidly and new methods are developed over time. Gore also stated the need for additional resources, particularly from the private sector. He highlighted the importance of private sector funding and delivery systems, stating that the NHI isn't workable without private sector involvement. More funding, more doctors, and more resources are crucial to the plan's success. He mentioned that with rapid economic growth and the development of various methodologies, the NHI might become feasible. However, in its current form, the plan is beyond the country's financial capabilities. Gore also stressed that the NHI needs private sector participation to secure the necessary funding and resources. This means significant adjustments to the current plan are essential for it to be practical and sustainable. Without these changes, the NHI cannot achieve its goal of providing any kind of comprehensive healthcare service to all South Africans. If the government tries to implement the NHI without raising taxes, South Africa would need an unprecedented economic boom. Discovery's calculations show that to meet the Health Department's NHI budget of 200 billion rand per year, the economy must grow at 7.2% annually for the next 20 years. This growth would increase tax revenue enough to fund the NHI without tax hikes. If the NHI covers primary care, chronic medication, maternity, and basic benefits, it will need an extra 600 billion. And for this to happen without raising taxes, the economy must grow at 8.6% annually for 20 years. And Discovery says advanced coverage like long hospital stays, specialist procedures, etc. would need nearly 1 trillion rand. And to achieve this without tax increase, the economy must grow at a staggering 10.4% annually for 20 years. Although these growth rates are very high, Gore believes it's the only sustainable way to fund the NHI. Let's be honest, it's highly unlikely that South Africa's economy can achieve the proposed growth rates of 8.6 or even 10.4% annually over 20 years. The country hasn't consistently grown more than 5% since before the 2008 global financial crisis. Given South Africa's recent economic performance and structural challenges, these ambitious growth targets are absolutely unrealistic. A more practical approach would be to explore alternative funding mechanisms or reform existing healthcare frameworks, rather than relying solely on extraordinary economic growth projections to fund the NHI. The proposed annual payroll tax of 37,000 rand plus per worker to fund the NHI is unsustainable for the average South African. This significant financial burden could strain workers' income, discourage economic participation, and drive skilled professionals out of the country, further weakening the economy. While universal healthcare is a noble goal, the estimated costs of implementing the NHI far exceed the government's initial projections. Relying on payroll taxes or other tax hikes fails to address the healthcare system's structural inefficiencies and resource shortages. Increasing taxes without robust economic growth or effective management will strain taxpayers and potentially harm the economy. The government must consider alternative funding mechanisms and reforms if they want to go ahead with the NHI scheme project, such as optimizing current healthcare budgets, leveraging private sector resources, and addressing systemic inefficiency in the current public healthcare system, rather than imposing additional taxes on already burdened South Africans. A collaborative approach is essential to achieving universal healthcare without jeopardizing the economy. What do you think? Do you think an additional payroll tax of 37,000 Rand per year to fund the NHI is fair? Or should the government explore alternative ways to fund the NHI? Or do we even need the NHI? Share your thoughts in the comments below. Thank you for watching, and if you found any value in this video, please do like, share and subscribe, and I will catch you in the next one.